Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over the 3 natural steps that you can take at home to relieve your carpal tunnel syndrome pain. But before I do that, I'm gonna go over what is a carpal tunnel, normal healing cycle, and what the surgical option and the complication of the surgery, and then how we can treat it naturally at home. So what is the carpal tunnel and what is the benefit of the carpal tunnel? So we have the carpal tunnel to protect the median nerve, and you can see it in here in this image, the yellow line here, that's your median nerve. And the carpal tunnel in this area is actually to protect the median nerve. So the median nerve going through the tunnel, so it will as a protection from like impact, especially on the top or the bottom from injury and stuff like that. So it's the roof of the tunnel is very strong band, and the roof is actually in here, and that band is a connective tissue that's called transverse carpal ligaments, and you can see it here, that white band, that is a transverse carpal ligaments, and you have the median nerve is going underneath that band. So when you have a carpal tunnel symptoms, you will start to have numbness and tingling in those 4 fingers. So you can have it in a hole in the front, and the 4 fingers in the front, and kind of half of this finger and your palm. And also you could experience weaknesses and gripping, like when you hold something, it will fall from your hand. That's with severe cases, dropping objects. And when you look in the back of your fingers, you will notice that the numbness and tingling happen on those 3 fingers here in the image, right around this area. And that's a very classic presentation of carpal tunnel, which is compression on the median nerve that go through the carpal tunnel. So the carpal tunnel surgery, what they basically do is they cut into the transverse carpal ligaments to kind of relieve the pressure over that area, so you don't have that pressure on the median nerve, so you don't have that numbness and tingling. So the common complication of carpal tunnel surgery is excessive scar tissue. So by definition, why you could have carpal tunnel, and it will make sense why the complication and the treatment will be different. Carpal tunnel, it's basically you don't have enough room in this area for swelling or scarring. And if you have a swelling and a scarring, that's kind of like compressing on the tunnel, and that compress on the nerve, the median nerve, and cause the nerve pain. So the surgery, it's basically cutting into the tunnel. The problem is with your normal healing, your body has to build the scar tissue to heal. And part of the complication of the surgery, too much scar tissue. So if you're not lucky, and your body build excessive scar tissue, it's gonna defeat the purpose of the treatment and cause failure, because you have more scar tissue, more inflammation from the surgery than after the surgery. So the common side effect is excessive scar tissue and inflammation and pain. And you can see here, this is a side view like this for your carpal tunnel. That's what it look like. This is a median nerve in yellow here. As you see, there is not enough room for inflammation. It's a very tiny area that 1 to 2 millimeters of inflammation or scarring can compress on the nerve and cause nerve symptoms. So what is a natural treatment for the carpal tunnel? So let's go over the healing cycle, and we're gonna go over a few of the treatment that currently used that doesn't work, but to really relate it to the healing cycle, so you know how to get to the root cause of the problem, and then we'll go over the 3 steps at the end of this video. So normal healing cycle for your body to heal has to go through 3 stages. The first stage of healing, I'm gonna use external paper cut for visualization, but the same thing happened internally in the carpal tunnel and we don't see it because the skin cover it. So the first stage of healing is inflammation, swelling, redness, the blood start to rush to that area, and that's a classic symptoms that cause the symptoms of carpal tunnel. You start to have inflammation from repetitive strain injury, repetitive motion, or trauma, or accident, or pregnancy actually that cause internal inflammation in the joint, or arthritis that cause inflammation in the joint and compress on the nerve. That could be possible. Second stage of healing is called the proliferation stage. That's when your body starts to build the scar tissue. If our body does not build the scar tissue, it's open wound susceptible for infection. So scar tissue very essential for our survival. The problem is when you look at the carpal tunnel here, we don't have much room for scarring. Any scarring, even 1 to 2 millimeters, is going to compress on the median nerve and cause the carpal tunnel syndrome. So when you have inflammation or a strain from like repetitive strain injury, from like swelling in the joint, or arthritis, pregnancy, or any hormonal imbalance that causes inflammation in the joint, that will compress on the median nerve and cause the nerve pain. And also when you have a strain here and your body builds the scar tissue, that could cause the pressure on the median nerve. So perfect scenario during the maturation stage, our body should get rid of everything in the proliferation stage and the inflammation stage. That's perfect scenario. But if you start to have a chronic condition, your body is going back and forth between inflammation and proliferation. So these are some of the treatment that's not effective based on a study. So this study looked at it's a literature review, looked at over 16,000 research article, and they came up with the conclusion that those treatment are not effective for relieving pain. And as you see here, the most common thing, and you can see it on YouTube, is like the exercise that will relieve your carpal tunnel. No, it doesn't work, because 8 systematic reviews, it shows that exercise and stretches is not effective to relieve pain. It provides either short-term pain relief or no pain relief. The same thing, acupuncture, dry needling, massage therapy, and I will leave the link for the study underneath this video. So when you look at the healing cycle, if you do exercise or stretches, actually studies show the stretching can cause more inflammation, so that could cause the symptoms to get worse. And I see a lot of patients, when they start to watch YouTube video for exercises to relieve those issues, sciatica, plantar fasciitis, or carpal tunnel, doesn't matter, musculoskeletal, they start to do that stretching and their symptoms get worse to the chronic condition, because actually stretching could cause more inflammation. And if you have a micro tear in the muscle, or a tendon or ligament, and you stretch it, what's going to happen? You're going to snap it, you're going to tear it more. So we want to avoid the treatment that doesn't work and sometimes cause more harm than benefit. So how to get to root cause of the problem? Simple. Look at the healing cycle and break it. So the first step, we have to decrease the inflammation. So in order to do that, if you are in initial stage of inflammation, rest should be enough to relieve it. But if you have a chronic condition for a while and you have severe symptoms, we have to be aggressive to decrease the inflammation. So what I personally do, and I give it to my patient to take home, use a MagnaHeal 2. This is extremely very strong magnet. The magnetic field about 3 inches that penetrate in the body. So I use that and have them to wear it, especially at night, on the rest area to decrease localized inflammation. Simultaneously, I put the patient on anti-inflammatory diet. This is extremely important because there's a lot of food cause internal inflammation in the body. And if you use the magnet to decrease inflammation and you're still eating the food that cause more inflammation, it's defeating the purpose. Lastly, for severe condition of inflammation, if your pain on a scale from 0 to 10 is 7 and higher, that's indicative you have severe inflammation, and we have to be aggressive to decrease those inflammation. So at the same time, while using the magnet anti-inflammatory diet, I like to put patient on anti-inflammatory vitamins and mineral and other ingredients to help to repair the internal tissue that had the damage. That's for severe condition for inflammation. So the step one is we have to decrease the inflammation. Second step, we have to break the proliferation stage. So the first thing we need to address in the proliferation stage is the scarring. Too much scarring going to be in the way and cause compression on the nerve. So I want you to look at this image. Your muscle look like nice and smooth like this. When you have a micro tear, it happened like very tiny tears in the muscle, and it look like this second image. And when you start to build the scar tissue happen randomly. And when that happen, you start to have it in a tunnel, and this is when you start to have tissue compressing on the nerve. So I like to break the scar tissue internally instead of cut and break it with the knife, because there's chance that you're gonna build the scar tissue from the cut itself. So what I personally do and I have my patient do is use the A3 to break superficial scar tissue while we're working on an inflammation, and for deep scar tissue, I have them use the A5 to really go deep to break the deep scar tissue that's compressing on the median nerve. The third step that's extremely overlooked by a lot of healthcare providers is the fascia system. I will explain it briefly here because I want you to understand the complexity of the system. When you understand it, you will appreciate the importance of the need to treat that system effectively. So the fascia system, when you look at this image, the fascia layer is the white filament here, here, and here. And when you go by meat next time, look at the white filament. That is the fascia system. So to make things complicated, but don't worry, the treatment very simple. The fascia system is divided into two major categories: superficial fascia and deep fascia. So the superficial fascia is like a layer wrapping the entire body, like a Spider-Man suit. And the deep fascia layer is divided to four subcategories, layers. And to make it more complicated, each of those layers has 1 to 2 layers on the top of each other. So the deep fascia layer divided to 4 subcategories. The apparatic fascia wrap a group of muscles, and then you have the epimysin wrapping each muscle fiber. Then the premiysin wrap a group of bundle of fibers here, and then at the end you have the endomysin wrapping each individual muscle fiber. Why I'm going over this? Because it's extremely important to understand we have fascia layer here. So if your fascia layer, the superficial fascia or the apparative fascia is tight, it's like you're wearing a t-shirt 2 to 3 sizes too small. So what it's gonna do is gonna compress on your wrist and carpal tunnel. And when you have that compression, and that's actually one of the tests we do in physical therapy to check for if you have a positive carpal tunnel, is the squeeze test. And that's actually what the fascia tightness does. It squeeze and cause the nerve pain. So we have to work on all these layers. We cannot pick and choose which layer to work on, because when you have a scar and inflammation, all these layers are like glued together. So we have to release it. So what I personally do is use the A1 to release superficial and apparatic fascia. Very easy to use, can be used at home. And then I use the A5, the same A5 we use it for the scar tissue. I use it to release the deep epimysin, premiysin, and endomysin. So the success of the treatment depending on implementing the 3 natural steps simultaneously. You cannot pick and choose. I'm going to work only on the inflammation. The inflammation will not break the scar tissue. Addressing the inflammation will not release your fascial restrictions. So for the best result, we have to address the inflammation, the scar tissue, and the fascia restriction simultaneously. So I will leave a link for those tools underneath this video. If you have any question or comment, leave it in the comment section underneath this video, and I will see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.